When someone is undergoing stroke, they will be looking or feeling ill. Changes in level of consciousness, they'll have numbness of face, arm, or leg. They'll have difficulty talking or understanding. They'll have blurred or dim vision, unequal pupil size, severe headaches, dizziness, confusion, and most importantly, they will undergo pronator drift. This is when their arms are out in front of them, they have closed eyes, and their arms seem to drift to one side. When treating someone who's having a stroke, there's not much that you can do. You want to make sure that before anything you call EMS if you know that they're having a stroke. Next, you want to comfort and reassure them. If your patient is excited or anything, you just want to calm them down as much as possible. Next, you want to monitor the ABCs. A stands for airway, B stands for breathing, and C stands for circulation. You can check their airway by just sitting there and watching them. Usually their airway will be adequate. You also want to check their breathing. Again, you want to, when you're sitting there talking to them, and you want to see if it is patent. Circulation, you can't really monitor it. You have to go and check their pulse. You can do this by checking right here at the radial pulse, or you can check their capillary refill. Next, what you want to do is you want to check their sample and vitals. Sample stands for signs and symptoms, allergies, medical history, pertinent past pertinent history, and last oral intake and events leading up to it. So, sir, what right now are you feeling exactly? Oh, okay. Next, you're going to look for the allergies. Are you allergic to anything? Okay. Are you on medicine? Has this ever happened to you before? And what was the last thing you ate? How long ago was that? And what exactly happened to you before you started feeling these symptoms?
I was sitting down. I don't really remember it.
Okay, that was sample. Next, you're going to check for vitals. The first thing in vitals is you want to check their eyes. Usually when you check for their eyes, you want to look for PERLA. PERLA stands for pupils equality, reaction to light, and accommodation. So what I'm going to do, usually I'll have a flashlight or something, or you can just cover up one eye and see if one, the pupils are equal. Then what you want to do is you want to shine a flashlight to see if their pupil opens or closes, accommodates the light. Then after that, you want to check the levels of consciousness. First, you want to ask them, what's your name?
David? Yeah.
Okay. And do you know what time of day it is? Morning, afternoon, or night?
I don't know. I can't remember.
Okay. And can you tell us where we are?
I don't recognize this place.
So based on that, he is ANO times 1. So his level of consciousness really isn't all that good. The last thing that you can do is to reassess every so forth to make sure that everything stays consistent or to see if they're getting better or worse.